Oops. Hi, my name is Mary Wong, and I'm a registered pediatrician and acupuncturist. I'm the founder of Alive Holistic Health Clinic and author of Pathways to Pregnancy. Tonight, I want to follow up on last week's post number 59, where I interviewed Dr. naturopathic doctor and author of 8 Steps to Reversing Your PCOS. Because I want to, like, instead of just introducing the book, we want to talk about more practical things that you can do if you actually have PCOS. So I'm really excited to bring with you one of our practitioners at Alive Holistic Health Clinic. His name is Alan, Dr. Alan.
That's okay. We can call each other Alan and Mary. How's that?
On my screen, you're using your wife, who, by the way, is another naturopathic doctor. So it's really cool to have Dr. Raz and Dr. Vu as part of our team. And they're like really dynamic duo because they are married. And a little before we start, first of all, thank you for being here. And it's late.
Thanks for having me.
It's after 9, so I apologize to the crowd that it's a little later than normal because we had some technical difficulties, and anyway, doesn't matter.
I have to put the kids to bed too, so that always adds a little bit of time too.
Yes. So what I want to say is that Dr. Alan Vu has been in practice for over 10 years, over a decade, and actually, you graduated at the same college as Dr. Fiona McCullough.
Yeah, that's right. Yeah, she graduated a little bit ahead of me.
Yeah, and same with Dr. Zainab Perez. So you guys are both from the same college. And what's really cool is that both of you are currently teaching at the Naturopathic College in Toronto, right? Is there a naturopathic college in Canada?
There's one in Vancouver. It's Boucher, and there's this one, and I think there's one opening up in Montreal pretty soon. But the one in Toronto is definitely the most established one. It's been there since 1978, I think. Yeah.
Right. So we were at the highly established, prestigious natural college in Canada.
Right.
And so it's such an honor to have both of you as part of our clinic and representing naturopathic doctors. And the reason why I have naturopathic doctors in our clinic is because I really am a believer of integrative medicine. And as you know, I'm a doctor of Chinese medicine. So there is an overlap and there is a balance between the two medicines. And because Fiona McCullough was a naturopathic doctor, and with that point of view, I wanted to get that point of view with regards to PCOS. So I just want to get, okay?
Yeah, for sure.
So what are some of the concerns that women have when it comes to PCOS? I know Fiona talked about the types of PCOS, but what are some of the long-term concerns of PCOS patients?
Yeah, for sure. And I think Dr. McCullough did a really great job of highlighting a lot of the important parts about PCOS, and I thought she spoke really eloquently on the topic, actually. And so, just follow through on some of the stuff that she talked about. If we think short term, there's a lot of the symptoms and that she talked about that we typically think of when it comes to PCOS. So, you're talking about the unwanted hair growth, like the hirsutism. She talked about it being, typically along the jawline, for example. Older women, sometimes it manifests as hair loss or hair thinning. The acne that can also happen in PCOS. You've also got the weight gain that can also come. Like 50% of women who have PCOS have the overweight, phenotype. And also can be difficulty losing weight as well, because I know that is also a challenge with patients with PCOS. you know, combined with all those short-term things, you've got the anxiety and depression that can come with dealing with those symptoms, and also, you know, the body image issues that come with that. And of course, you know, if we're talking about, a little bit more about the focus of, you know, your practice in your clinic, and we're talking about the fertility challenges that happen with that too, you know, with the ovulatory dysfunction that can happen with PCOS, and that's probably one of the big ones that when we're talking about, obviously, with fertility, that we have to think about too. So that's probably the short-term things, and you know, long-term, it's important to think about some of the ramifications too, like cardiovascular disease. That's probably the big one, because you know, you have glucose tolerance problems, you have insulin resistance problems, you know, metabolic syndrome. You know, all those are associated with PCOS, and so those are all important things to think about in the long run too. So even for young women who have PCOS, it's the important things to think about for the years to come too.
So then, with PCOS, oftentimes we find that there is no ovulation, you know, there's a lack of menstruation or menstrual cycle, if at all, right? So, from your perspective as a naturopathic medical doctor, what do you do to induce ovulation? I mean, you know, in our arts, of course, we're definitely using acupuncture and Chinese herbal medicine in
Yeah.
a different way, natural way. And I know that a big bulk of your practice is about, you know, altering lifestyle naturally. So
Yeah.
that's that.
Yeah, no, I think that's exactly it. I think, you know, diet and lifestyle is really foundational to health, you know, all kinds of health conditions. But I think with PCOS, that's particularly true. You know, if you're thinking about diet, Dr. McCullough talked a little bit about this too, but you're really trying to work on the insulin resistance. So there's many studies to show that the Mediterranean diet, which is the diet that, you know, has a lot of whole grains, whole foods, you know, plant-based, healthy oils. So that Mediterranean diet has been shown to help with the insulin resistance. It helps increase weight loss, and also the low carbohydrate diet. So I think she mentioned a little bit about glycemic index. And so, you know, when you want to look up glycemic index and glycemic load, so those aspects are really important to think about when you're picking your diet, and when you're making your nutritional choices. So yeah, so we like to combine the Mediterranean diet with a low glycemic index or low glycemic load diet to help induce ovulation. So you know, I think that that's a big part of the diet. The lifestyle part, like the exercise part, you know, studies show that 120 minutes a week, and some studies even going up to like close to an hour a day for, you know, 5 to 7 days, which is pretty intense. I don't know that many people who are able to do a whole hour for 7 days a week, but you know, even like a 5 to 10% weight reduction in those patients with PCOS who are overweight, for example, you know, that can improve a lot of parameters, and including with ovulation as well. So exercise. So, you know, there's a whole bunch of tips out there on how to incorporate exercise into your life. You know, picking something fun, picking something you'll do, picking someone to go with you, increase accountability. All those little things can help get people out and doing something fun for exercise. And, you know, I think that's also really important part of it.
I think that's really great. And with regards to the exercise part, a lot of women, if they've already gone to a fertility clinic, one of the things that they are told though too is like, oh, you shouldn't really exercise so much because, you know, you don't want to, I don't know, with regards to the hormones that they're being injected in with or
Yeah.
something. Like, can you address that piece? Because I think it gets confusing as to how much to exercise, how, you know, not to exercise, or what should I do, what should I not do. Want to address
Yeah.
that?
Yeah, that's a really good question. That's a good point. You know, a lot of the studies are talking about moderate exercise, so not like super vigorous exercise. You know, you don't want to go too far on the other end and start to have like too lean body composition, for example, where because that being too lean can also prevent ovulation as well. So, but yeah, so the studies are there on moderate exercise, and so you want to exercise to the point where you're getting your heart rate up a little bit, and maybe that it's a bit hard for you to finish an entire sentence when you're at the peak of your exercise, but being able to say a few words at a time, like that's probably a good place. If you feel like you're pushing it too hard, then step it back a little bit. It's about remembering that moderation is the key here, even with exercise.
And one thing I want to add in, so thank you for that, is that in Chinese medicine point of view, like you don't want to overextend your energy because of course you want some
Mm-hmm.
reproductive organs, right? So one thing that we say is, after
Yeah.
exercise, are you more tired? Because really you should, in
Mm.
fact, if anything, you should be invigorated and more energized, right? So
Yeah,
that can
absolutely.
be a really good age. So if you're tired,
Yeah, I think it's a great tip.
then probably you're doing it too hard.
Yeah.
But if you feel more invigorated, more energized, then absolutely that is key.
Yeah, for sure, for sure. You don't want any of the signs of overtraining, or if you find that you're getting, like you said, if you're overtired afterwards, or if you find that you're getting a lot of, colds or flus, and more susceptible to that, or you're having a really hard, long time recovering after your exercise, then those are probably signs that you're probably pushing it a little bit too hard. So that's a great tip.
Good. Okay. So when you talked about the diet already, you talked about the Mediterranean diet, lower glycemic index diet. So, you know, um, do you have anything above and beyond this, or like, is there like a special superfood that you go towards?
Yeah, I mean, I think I don't know about superfoods. I think that there's a lot of one thing I like to talk about with a lot of my patients when they're just kind of trying to revamp their diet or trying to clean it up is there was a book called the Okinawa Project, and they talked about having a variety of colors because they basically studied a population of people who had greatest percentage of people over 100, I think, or basically a really high longevity. And one of the things that they talked about was having different colors in their food. So I think that if you can one good rule of thumb is having 5 colors. Try aim for 5 colors at every meal. So that helps to ensure that you're getting a wide variety of vegetables and fruits as well. And then you're getting a whole bunch of different antioxidants and different nutrients. And so you're really getting a full spectrum that way. And if you can try to vary it even at every meal, then that really helps you get a nice wide variety, and that will probably help you quite a bit.
I think that's a really excellent point because I think a lot of people are kind of stuck in a habitual way of eating and they could
Yeah.
eat the same thing every single day. I've had people tell me just that, right? It's like, oh, I could eat the same thing every day.
Yeah, for sure. I mean, I guess there's a reason on food blogs and all that, the pictures are, really various, really colorful, different ingredients and so on. And rather than sort of, I guess, what sometimes we think of in the standard North American diet of like just sort of bland, brown, brown everything on the plate, So, but yeah, I think that's a good point.
Okay, super. And then to piggyback off that, like I know, unfortunately, over the years, I've seen really like a downfall in our food quality and what we get. I mean, you
Mm,
can everything from, you know, all over the world now at our local grocery store.
yeah,
So, like years ago, if you asked me 20 years ago, did I believe in supplementation? I would actually say no. Now
right.
I'm the opposite of this because I'm weary about the food quality that we have. So um, that brings to mind supplements, and this is where you really shine. So what are some of the supplements that you would use? Maybe like top 3 for PCOS, just as a blanket statement right now. I know every one is different,
Yeah.
but more more overall, what would some of those be?
Yeah. Oh, sorry, you're cutting in and out a little bit. But I think you're asking me about the top, some of the top supplements that come to mind when it comes to PCOS. I think the one, definitely the one of the big ones is myo and inositol. So myo-inositol, it helps restore ovulation. It helps improve egg quality. There's a lot of good research on it. You want to be thinking about the myo form and not the chiro form. So that's something just to keep in mind. The other thing that in terms of just making sure that people are safe when they're thinking about using it, you have to be cautious if the person who's going to use it has like bipolar disorder or schizophrenia, because that there is the potential that it may unmask like a manic episode. But for the vast majority, people, they tolerate pretty well. You just have to be careful. Sometimes, if you take too big of a dose at the beginning, you can get some gastrointestinal symptoms like loose stools and so on. So that's one that people tend to have to ramp up slowly, and that's something that it's good to check in with somebody. Like let's say your ND or healthcare provider for that, just to kind of make sure that it's being done properly. But it's generally well tolerated, and there's a lot of good research for that one. So myo-inositol is probably a big one for PCOS. So even and one that you may want to start earlier, even in younger women who aren't even necessarily thinking of like their fertility health immediately. I would say vitamin D is one that is pretty easy to do, pretty easily found, pretty cheap, and you just want to make sure that that the vitamin D status is adequate, because there are studies to show that if it's deficient, then that can lead to problems with PCOS, and people and women with PCOS are more prone to having lower vitamin D. And if you're like us and we live in Toronto, we've had a great October so far, I think, in terms of weather, but really typically we don't get nearly that much not nearly enough sunshine. So, a lot of the population in the Northern Hemisphere is found to be deficient. So that'd be one to do, especially if you're deficient. So getting their levels checked is probably a good idea.
And more expensive, I think. What is it, $50 to $75?
Yeah, it's not too expensive. Sorry, I can catch that one. You cut up for a sec.
No, I'm just saying that to do the test.
Yeah.
Blood test, and you can just check, because as you say, most people are deficient.
Yeah. So most doctors, NDs or MDs, can run the test for their patients, and it costs maybe about $40 to $50 or so. It used to be a lot more expensive, but the prices come down, I think, as the technologies come along and more people use it. So yeah, it's fairly reasonable when it comes to lab testing, and it's probably good to get a baseline check. I encourage it with most of my patients, just to get an idea as to where their status is.
So back to the myo-inositol, I do have one question.
Sure.
If so some of the women that are and they know they have PCOS and they're at a fertility clinic, they are given metformin.
Okay.
Is it okay and safe for women to be taking myo-inositol with metformin?
With metformin, I believe that it is okay. I'd have to triple check that, but and it, I think it is okay for most cases. I'd have to double check that one to be sure. But yeah, I think that the interactions are okay on that one.
Mm-hmm.
Yeah.
Maybe.
I could have double checked that one beforehand and just to make sure, or maybe we can always post it afterwards.
Yeah, that's exactly what I was going to say. You can post it up after, just
Yeah, for sure.
Yep.
Yeah, I just want to make sure before we just in case anybody takes it as advice and maybe goes out and does it. Yeah, because I know you're right. A lot of women on PCOS are on metformin is one of the medications that they might be on. So, but yeah, I could double check this and also tolerate okay together.
So I've seen people take it and it seems to be okay.
Yeah.
It would be great if you have also like research behind it too.
Yeah,
If you
for
can
sure.
share, that would be awesome.
Yeah,
Is
I
there?
promise.
I know you're good for that. So, so we got myoinositol, vitamin D. Was there one more that you would say?
Yeah, CoQ10, or because that helps a lot with egg quality, including in women with PCOS, more specifically too. So that's one that a lot of people might think about, and has some good research behind that. Um, and N-acetylcysteine is an antioxidant and can help with glucose dysregulation. Um, they used to, especially in patients who before were on like Clomid, it would help too because it could help with the thinning in the lining. But I understand the Clomid's been discontinued, so that may not be as much of an issue anymore. So,
Well, actually, I still see people go on Clomid.
oh yeah,
Yeah,
okay,
it's still,
okay,
and it's shocking.
yeah, yeah. Maybe there's a outside market, a gray market for or something.
Well, and I have to say, not everyone has negative reaction to Clomid, but by and
Yeah.
large, they do. So
Yeah,
it
for sure.
depends.
It's just one of the concerns, that there might be like that it can have like thinner endometrial linings. So I think that was, one of the reasons why sometimes they would switch to medications other than that. But yeah, absolutely, some people don't react poorly at all to Clomid, and it does well for them.
Yeah. And but that's beyond this conversation here. Maybe that's another topic.
Yeah,
Okay,
yeah.
well, thank you. Any other last word of burning advice that you want to share with women that are watching?
Yeah, no, I mean, I think I like the overall message. I think that your book has that, it's an overall positive message, and I think that that's something to try to carry forward. With anybody who's watching who's going through some of these challenges, right? Especially if they have PCOS. But the nice thing, like Dr. McCullough said the other day, was that PCOS is something that can be worked with when we're talking with fertility challenges, right? For some women, it takes a little bit longer, and it may take a bit more effort, which can be frustrating. But there can be really good results. And I think that the positivity and the message that you're putting out there, I think is important. And hopefully people can keep on hanging on to that and keep on soldiering through.
Thank you so much. And you're absolutely right because especially let's take the average person with PCOS where they're typically more overweight. Well, everyone talks about the whole diet and lifestyle exercise piece, but the
Yeah.
reality, you don't have to look perfect. You don't have to be perfectly lean
No, absolutely.
to achieve pregnancy, right? Because then that would just be more discouraging when
Right.
looking for something that might not be um, realistic. Because as we also know, a person with PCOS has a setback in terms of trying to lose that weight. It's more difficult. So we cannot,
Yeah.
we cannot aspire to have that model-like figure. But when
Yeah,
we,
for sure. It makes me think of a few of my patients who have PCOS and who who really struggled with trying to, and they were doing everything, textbook exercise and diet wise, and it was taking them a really long time to lose weight. So but like you said, nobody has to be, look like they're going to be on a magazine cover or anything like that. I really like that research that showed that even just like 5 to 10%, weight loss can change, a lot of the metabolic parameters and the outcomes. So I think that that's really encouraging. You don't have to go down to like a BMI of 20 or anything like that. So
absolutely
it's nice to see the research showing that.
right, and then as a person, as the recipient, as the person going through that, and say, "Oh wow!" Instead of like having that marker of "I want to lose 50 pounds," it's like, well, let's just see how we feel. Are
Hmm.
we having better period menstrual cycles? Are we
Yeah.
having acne? Are we having less hair loss? I mean, that's a better parameter, I think, right?
Yeah, exactly. Yeah, I agree with you 100%.
So anyway, that's how we'll leave it. Thank you so much for your contribution, and I'll see you tomorrow.
Yeah.
Yes.
Yeah. Yeah, that'd be nice.
POS patients then.
Yeah, exactly. Exactly.
Well,
Yeah.
thank you for staying on, and I'll end the broadcast. And thank you so much for being with us. And next week, we'll be back to Wednesday, 8 p.m. Eastern Standard Time. And I believe, I don't have my calendar in front of me. I think next week is the time that I will be having Natasha back. And she is the person who has the lean PCOS type.
Mm-hmm.
And
Mm-hmm.
she ended up, well, anyway, you'll hear about her miracle story, which is pretty crazy and awesome. And
Yeah.
let it be a point of hope for you rather than, oh, gee, I don't know if I want to hear about someone else's success when I'm struggling. But I
Mm-hmm.
say, please come aboard, listen to what we have to say, and just inspire hope from that. Okay? So 8 p.m. next Wednesday, Eastern Standard Time. And yeah, check us out. Check out more of the past posts. There's lots of tips, even some recipes that are healthy. And check out my book, Pathways to Pregnancy. And thank you again, Dr. Alan Gu, for being here tonight. And I know we both had a busy day working and
Yeah.
still, working away.
Yeah.
For the love of the people.
Yeah, for sure. It's
Thank
been
you.
fun. Thanks so much.
Thanks. Yeah, awesome.
Okay. Bye.